So I'm going to let Dr. Kim explain exactly what he did to me and why he did it.
Yeah. So obviously for Aaron, I was considering his desire to get back in the ring, and my interest was definitely to try to get him back there. And so the priorities are try to maintain as much motion as possible, limit fusions when possible, and that's exactly what we did for him regarding his neck. Did a laminoplasty procedure, which achieved the goal of decompressing the spinal cord and decompressing the nerve roots that were controlling the rest of his body because he had a lot of stenosis in that area, could be prone to significant injuries, especially if he's in the ring. And he also had evidence of pre-existing spinal cord damage from his prior fights, probably. And I think now his spinal cord is somewhat quote unquote de-risked because we're able to decompress the spinal cord without doing a fusion operation. So he has full range of motion of his neck. So for all the grappling and all the positioning, spinal cord safe without limiting the motion. For the lumbar spine, a little bit of a different situation. The areas of the stenosis that were resulting in the foot drop, those were attempted to be decompressed previously. I think you had surgery before, right, Aaron, before you got to me. And there were some imaging characteristics when I saw him that I thought that operation that he had previously was probably not the best to regain function of his leg. And sure enough, I guess 2 or 3 months later, you were back, and I saw you at that point, and he needed a fusion for the lumbar spine. But my goal is to make sure they heal very quickly. So thank God to technology nowadays. Fusions used to take 6, 7 months, 8 months, but we used a substance that allowed the bone to heal super fast. It's a 3-month CT scan today demonstrating solid fusion from L3 to 5. It's only a 2-level fusion. Most of my patients who have 2-level fusions go back to full activities, whether that be running marathons. I have patients who have competed at the national level for CrossFit, also some other competitive athletes in the fighting sort of sport as well. So, Aaron's going to be one of those. I just gave him the clearance to go back to conditioning, hopefully hit the mats in about 6 weeks, make sure he's up to speed, and then competing shortly thereafter that. So depending on how he's feeling on the mats and stuff like that. So
Why is it when you have foot drop that there's a certain amount of urgency?
So usually when you have foot drop, it means that the nerve has undergone a significant amount of trauma, right? And the nerve is damaged. Mm-hmm. And so the nerve has to regenerate the connections to the muscle after it's been damaged. So that's why you may need a little bit more time to get the full strength back. That's what the conditioning is going to help you with. But if you do develop that sort of weakness, the goal is to decompress you as soon as possible, because the time starts where you could develop permanent injury that never recovers. And I think the sooner you get to it, the better it is for your recovery.
And you said my prospects, now I'm back to train, and you expect a full recovery. What are the dangers that I should be looking out for?
So I think you're going to have to really focus on strengthening your muscles tremendously, especially your core muscles. You got to protect the spine. And obviously you could do activities like bending, twisting. You could lift, you could deadlift, you could squat, you could do all those exercises, but you have to maintain excellent form, keep your core as strong as possible. I want your core actually to be stronger now after you start working on it than it ever was.
Okay.
It should be the main focus. And then the leg strength, I think, will come back. Some of the nerves require 6 months to fully recover. Mm-hmm. So I would say work on conditioning in a very focused way. I think everything I'm saying to you makes a lot of sense because you're already an athlete. Mm-hmm. So I love taking care of athletes in that respect because they really know their bodies. They know what to do, correct form and posture to do these exercises to get you to 100%.
Well, Dr. Kim, thank you so much. I cannot express to you how grateful I am.
My pleasure.
I have to say, a lot of doctors telling me I'm done. So you worked a miracle. So I appreciate it.
We're looking forward to seeing you with the medal in a couple of months.
That's right. Thank you.